Hey guys. Hi guys. Hey guys, this is your girl Nurse B, and I am here to do like an NCLEX review with you guys. I know I've been posting like practice questions on my posts to help you guys, and a lot of you guys have been getting them all right. So I just wanted to come on here and go over questions with you guys, go over the rationales, see why this answer is correct, why it's not, stuff like that. Nursing is a very good field. I'm being a nurse, and I feel like giving back is important. So I give back on my platform. I am putting information out to help nurses, future nurses, I should say, students. Type in. I grab my paper right quick, but these are the practice questions we're going to start with. I did post some of them on my post page. Not on my post page. I did post some of them already on the post part. But for those of you guys that have not seen this question before, we can go over them together. And as you guys are joining, you can put your answer in the box or, in the comment section. You can say why you think this is the answer and why you don't, and vice versa. So, we are going to start with one. Grab this. Sorry, right quick. But let's get into it, guys. Alright, so we're gonna do number one. Number one, it says a nurse is preparing to administer medication via nasogastric NG tube. Which action should the nurse perform first? So we have A, flush a tube with 30 mLs of water. B, verify tube placement by aspirating the gastric contents and checking the pH. Okay. And C, flush the medication and dissolve it in water. And position in superposition. Now, in this case, you want to do like a process of what is important for this patient. So what would you do first? You put the NG tube in. Okay. Now going to administer medication, but you don't know if it's like in the hospital. Initially put an NG tube in. We do an X-ray first before we do anything. But in this case, the NG tube is already in, and they're trying to make sure. Hi, logo checks. Hey. So we're trying to figure out what to do first. What is priority? So we're not going to flush it with 30 mLs of water. Of course not. That's not what you want to do. So that would be a no. The question is saying you're going to administer medication via the NG tube. So, of course, if you're coming on shift, the patient already has an NG tube. It was already verified with the X-ray that was in place. You're not going to just, you start your shift and then crush medication and just let it dissolve in the water and put it in the tube because you don't know. You don't know. I mean, yeah, the X-ray says it, but did you do your initial assessment as a nurse to make sure that, the NG tube is in place? So you wouldn't do C, of course, and then position the patient in a supine position. So the answer would be, guys, what do you guys think? What do you guys think the answer would be in this case? So the answer is B. You're going to verify the tube placement by aspirating the gastric contents and checking the pH, which is imperative. Like, you need to do this. If you have a patient that has an NG tube and you're trying to give meds, and your initial assessment, besides the initial x-ray, is to check the gastric content. So you need to check it. That is important, because that will let you know that the NG tube is in place, and once you do that assessment, you can then give your patient the medication. Okay? Now, the rationale behind this, okay? Let me put the rationale up for you guys. Okay. I don't know if you guys can see it. You guys can't hear me? I can't hear you. Can you hear me? Oh, man. Hold on. Let me see. Can you hear me? Hold on. Can you guys hear me? Ooh. So nobody can hear me? I'm trying to figure out how to write. Let me see. Hold on, guys. Can you guys hear me? Yes or no? Hold on, guys. Can you guys hear me? Hold on. Let me check. 1 second, guys. 1 second. Can you hear me? Can you guys hear me? Can you guys hear me? You guys should hear me. Okay. See. Can you guys hear me now? I can't hear you. What are you doing? Yo, we're doing NCLEX practice questions, but I need to know if you guys can hear me or not. Or if I need to restart the live. Let me know. All right, so I'm going to continue. If you guys cannot hear me, I'll just restart it. So you are going to verify the tube placement, which is priority before any NG tube administration to prevent aspiration. So you got to make sure the NG tube is in the stomach. You don't want it in the lungs, because, of course, that will cause aspiration. You don't want that, then it can lead to aspiration pneumonia. Okay? The gastric aspirate should have a pH of 5.5 or less. Now, supine position increase the risk of aspiration, so you wouldn't have the patient in that position. The head of the bed should be raised to at least 30 degrees at all times when you're putting medication down the NG tube. And then flushing and crushing medication come only after you confirm correct placement. Like I said before, you need to make sure that it is in place before you administer any medication down that NG tube. Because if you don't verify it's in place, and if that NG tube is in the lung, the medication will be going in that patient's lungs, and you don't want that. So there we go with that case. Okay. Now I'm gonna go to question number 2. I don't know if you guys can hear me, but I'm going to move on. You guys didn't say anything else. So, but pop in and out as you guys please. Okay. Now, number 2, I am going to bring that back. Let's see. Okay. Number 2. A client has a prescription for a trough blood level to be drawn for vancomycin. When should the nurse schedule the next blood draw for this? So, vagal trough is done. They want to see the levels before you continue this treatment, or if you have to decrease or whatever the case is. Now we have A, 30 minutes after the infusion is completed. B, immediately, hold on, I don't know if you guys can see. Immediately before the next scheduled dose. C, 1 hour after the infusion begins. And D, anytime during the dosing interval. So, what do you guys think? Let me know what you guys think. The answer is I'm trying to adjust it so you guys can see. Can you see? I know it's like awkward. Okay. Maybe, okay, this position is better. Like, okay. A, 30 minutes after the infusion is completed. No, because we need to know what the trough is before. Okay? B, immediately before the next scheduled dose. I mean, do you want to know? Would you want to know immediately? Would you not want to know? 1 hour after the infusion begins. And at any time during the dosing interval. Now, in this case, the answer is going to be immediately before the scheduled dose. And nursing students, once you guys become a nurse, you guys will be doing this in the hospital. We did a lot of vaco trials and stuff like that. But in this case, it's going to be B. We need to know immediately before the next scheduled dose what the trial is. Okay? And then let's go to the rationale. Right up here. It's a little cut off, but all right. Trough levels represents the lowest drug concentration in the blood and must be drawn immediately before the next scheduled dose, at least within 30 minutes. This ensures that the drug has reached its nadir peak levels and are drawn after the infusion. Well, peak levels drawn after the infusion. Inaccurate timing results in incorrect dosage adjustments and potential toxicity or, subpar therapeutic levels. So this needs to be done prior so we can know what the trough is and if the doctor needs to change anything in that nature. So that's where we are with that. If you guys have any questions, let me know down below in the comment section. But yes, we're going to move forward. All right. So the next question, I'm trying to adjust it so you guys can see. Okay, let me just get out the screen. I'm gonna get out the screen so you guys can see. Okay. Okay. A nurse is changing a sterile dressing. During the procedure, the nurse sterile glove touches the outer edge of the sterile field. what should the nurse do? Now it has A, continue the procedure. The outer 1 inch is not considered sterile. B, wipe the glove with the sterile gauze and continue. C, stop the procedure and don a new pair of sterile gloves. And if you guys don't know what don means, that means put on a new set of gloves. And then we have we have D. And D is, hold on. Okay. And D is notify the charge nurse before continuing. Now, in this case, what would you guys say the answer is if you had to guess? All right, so in this case, the answer would be stop the procedure and don a new pair of sterile gloves. Okay, so the rationale behind this is the outer 1 inch of the sterile film is considered contaminated. So you are not going to continue the procedure with you touching something with that glove. Okay? You are not going to wipe the glove with the sterile gauze and continue. It's already contaminated. Okay? In this case, the nurse must stop immediately, remove the contaminated gloves, and apply a new pair of sterile gloves to maintain, sterile technique. And this also will help prevent surgical site infections. You do not want your patient to have an infection. Um, Whether you're doing a sterile procedure with a catheter or if you're assisting the doctor in surgery or like a sterile bedside procedure, you need to remain sterile. And if you break sterility, make sure you change the new gloves. You change those gloves, with a new pair of sterile gloves. That is imperative. That's important. Please always keep that in mind. And this goes for all sterile procedures, surgical procedures, any procedure that needs to remain sterile, you must do this. Okay? So we got that. If you guys have any questions, please drop it down below in the chat and then I'll answer them. But I am going to move forward. I'm going to do like a few questions. We'll probably do 10 questions. And then I'll leave this video up. And then if you have any questions, let me know. And if you want more videos like this, please let me know. Okay? So we did number 3. We're going to go to number 4. So let me change that over. All right, can you guys see number, let me see, make sure it's changed. Let me know if you guys can see this. It's all squished and stuff, but if you guys can't really see it, I'll read it out loud. Number 4, a nurse is caring for a client on contact precaution. Which PPE should the nurse don first before entering the room? We have contact precaution, we have airborne, we have standard precaution, we have a lot of precautions. Now, your patient is on contact, okay? What would you do first? Would you put on gloves first? Would you put on the gown first? Would it be your mask? Would it be eye protection? Which one would you do? All right, I'm going to give you guys a few minutes. But let me know which one you guys would do first. And we'll go from there. In this case, you would put on the gown first. Okay. In this case, you would have the patient put on the gown first, and this is for contact precaution. So for contact precaution, and this is the rationale behind it, the gown is donned first to protect your clothing and skin before applying other PPE. So the priority is you need to protect your clothing, your skin, or anything because you're coming in contact with something. So the correct sequence in putting this on is your gown, then your mask or your respirator, and this is for contact patients, your goggles, and then your face shield, and then lastly, your gloves. Okay? Gloves are applied last because they are most likely the item to become contaminated and must remain clean until the moment of care. So always remember, in this predicament, you need to put on your gown first. Okay? Put on the gown, then your mask or your respirator, your goggles, face shield, and then your gloves is last, which makes sense. And I think I'm going to do a video about PPE. I think that's very important. So I am going to work on doing a video for that. Yes, Maya, B, put on that gown. You got it, girl. All right, we're going to go to number 5. We're going to do a few more questions before I get off of this live. Number 5. The nurse is preparing to insert a peripheral IV catheter. After inserting the needle and seeing blood flash back, what is the next step? So I just want you guys to think about this question. All right. What is the next step? It has the first one is A, withdraw the needle while advancing the catheter. B, immediately connect the IV tubing. C, apply a tourniquet proximal to the site. And you have D, secure the catheter with tape before advancing it. Right? The answer is going to be A. You withdraw the needle while advancing the catheter. This is a very, very important when you're starting an IV. The rationale behind this is after blood flashback confirms venous entry. So after you get that flashback, that's telling you I am in the vein, and that is where the nurse lowers the device angle and advances the catheter slightly. You don't have to shove it in, you just thread it in a sense, okay? Then you withdraw the sharp needle, like I said before, while simultaneously threading in, that catheter into the vein. Now, the other options wouldn't be good, like leaving the needle in place. That's a risk for vein perforation. We never leave the IV catheter needle in place. Once you get that poke, get that flash of blood, you withdraw the needle and thread that catheter into the vein. Okay, you never leave a needle in the vein. Always remember that. The tourniquet should already be in place before the insertion. Okay, because that's imperative. Okay, you're trying to get an IV in, you have to make sure that tourniquet is in place. Connecting the tube in and taping it, this happens after you fully have the catheter in place, it's working well, you flushed it, you get blood draw back. That is the last part when you're connecting everything together. Okay? Alright, next question. Number 6. A client is admitted with chest pain. The 12-lead ECG shows ST elevation in leads 2, 3, and VF. So, which area of the heart is most likely infected? Okay, you have the interior wall, you have the lateral wall, which is B. Then you have C, the inferior wall, and then D, you have the posterior wall. All right. Leads 2, 3, and AVF are inferior leads, and the view inferior wall, and they view the inferior wall of the left ventricle. So this answer is going to be C, the inferior wall. That is where we're going to see the ST elevation in those leads. So ST elevation in these leads indicates an inferior STEMI. Okay, so that's that position. Anterior MI affects leads B1 to B4. Lateral MI affects reflects 1 and ABL V5 to V6. And then posterior MI produces a reciprocal ST depression in V1 to V3. So these are important, and going over EKG and knowing the rhythms and then knowing the placements and stuff like that is really important. You're going to do this a lot on the floor. Once you become a nurse, you're going to do a lot of, and if you don't, please ask. If you don't have that experience putting on an EKG and reading the rhythm, you need to ask. You need to ask, hey, can I do this? Because you're going to do this a lot on the floor. I do it a lot on the floor. There's always doing an EKG and stuff like that, because anything changes, stuff changes, and then the doctor's just going to order it, so you need to know how to do that. And you need to know how to read it. So that is important. So that is it for number 6. We are going to do a few more questions, and then we'll be done. We'll be done with this lab. Of course, I'm going to come back later. I had a little break, so I wanted to do like a little practice with you guys. All right. Now let's go to question number 7. All right. So number 7. A client. Okay, this is a good one. It's about heparin, and you're gonna get a lot of these on the floor. Get familiar with heparin. Get familiar with doing EKGs, reading EKGs. But let's move on. Number 7 is about heparin. A client is receiving IV heparin, has an APTT result of 180 seconds. Therapeutic range is from 60 to 100 seconds. What is the nurse priority action? What is the priority action in this case? You have A, increase the heparin infusion rate. B, notify the provider and anticipate stopping or reducing the infusion. We have C, administer vitamin K as an antidote. D, recheck the APTT in 4 hours without changing the infusion. Now, what would you do? I'm going to read it again. A client is receiving IV heparin has an APTT result of 180 seconds. The therapeutic range, pay attention to this part. The therapeutic range is 60 to 100 seconds. What is the nurse priority action? Alright, and the answer is going to be B. Notify the provider and anticipate stopping or reducing the infusion rate. We always do this on the floor. This is very important that you do B. Notify the provider and stop or reduce the infusion rate. So it'll give you the parameters, like once you're in the bar, Um, it's either Epic. I don't know what system you guys use, but it's Epic. You'll see in the Amara, the parameters. Sometimes it'll tell you if you need to adjust like decrease the rate or increase it. And sometimes if it's like over that number of the primary range, you would need to contact the provider because the provider will let you know what needs to be done next. So always keep that in mind. Heparin, the rationale behind it is an 8 TTM 180 seconds is dangerously super therapeutic. So it's very, very dangerous. This indicates excessive anticoagulation and it's a high volume risk. The nurse must immediately notify the provider who will likely reduce or hold the infusion. Happens all the time. All the time. Promethazine sulfate, not vitamin K, versus copper. So protamine sulfate is what is used. It's not vitamin K. Protamine sulfate versus copper. Vitamin K reverses warfarin. Okay. Waiting without acting is unsafe and constitutes a pharmacology rescue. So don't just be like, and a kickback. No, because you're putting that patient in risk of bleeding if it's too high, or if it's too low, like you're putting that patient at risk of not being able to talk properly. So you need to pay attention as a nurse. I'm telling you, pay attention. It's very important. Okay. Now, number 8, a nurse is caring for a client in heart failure with a blood pressure of 88 over 50. Heart rate is 118. He has crackles in the lungs, JPD, and 3 plus PAD. Which position is most appropriate for this patient? In this case, we have A, supine with legs elevated, B, high collars, 90 degrees, C, Trans-Dellenberg, and D, left lateral recumbent. What do you guys think? In this case, the answer would be B, high collars, 90 degrees. Okay? Very, very, very important. The rationale behind this is high Fowler's position, which the head of the bed is 90 degrees, uses gravity to reduce venous return to the heart. So the patient already has capital going on. You don't want them in a position where it's going to cause more harm to the patient. Okay. So in this position, high Fowler's 90 degrees, it's also decreasing preload and pulmonary congestion. Okay. So thereby improving oxygenation and breathing effort. So this helps a lot. Supine with the legs elevated and Trans-Dellenberg both increases the venous return and both worsens pulmonary edema. Left lateral is used in pregnancy and during resuscitation. Okay, so keep that in mind. So I'm going to show the rationales for 7, 8, and 9 in a bit. I'm just going to do 9 right quick. 9. A client on telemetry has a rhythm showing absent P waves, irregular PR intervals, and a ventricular rate of 110. The nurse identifies this as what? A, ventricular fibrillation, B, afibrillation, C, third degree heart block, and D, sinus tachycardia. All right, let me know what you guys think. So this answer is going to be B, afibrillation. Okay, it's going to be AFib. And the rationale behind this is AFib is characterized by the absence of distant P waves. Always remember that. And irregular RR interval, and a variable ventricular rate. So always remember that. Ventricular fibrillation has no organized complexes at all. Third degree heart block has a slow, regular ventricular rate with a complete VAB disassociation. Sinus tachycardia has a regular rhythm with clearly visible P waves before each QRS. So pay attention to that. Very important. It's very important that you know ECGs, stuff like that. It's going to help you identify different, different stuff that you don't heart. So that is there. Let me pull up the rationales for that section. This one is for numbers 4 to 6. And I need to fix this for next time. Because it's kind of cut off, so you guys can't really see. But I'll fix it for next section, for the next session. And then this is the one I was just reviewing. But yeah, for the next section, we're going to I'll fix it for the next section. But yeah, guys, NCLEX is hard. I'm not gonna lie to you. So please make sure you're taking it very serious, studying wise. It's very important. The test is no joke. Yeah, it's no joke. Make sure you get material that's going to prepare you for the NCLEX. And yeah, I think you should be on your way as far as studying for NCLEX, making sure you're prepared for the practice questions. If you want it, you're going to be trust me. Alright, so we're going to move forward. That was number 9. So we're going to do 10, and I think that'll be it for this session, and then I'll continue on later on in this week. So let me go to question 10. I don't know if you guys can see it. I'll just read question 10 because it's kind of cut off on the bottom. Okay. A client with hypertension is prescribed lisinopril. This is a very good question, guys. Let me read it again. A client with hypertension is prescribed lisinopril. Which client statement indicates a need for further teaching? We have A, I should take this medication even if I feel fine. B, I can take ibuprofen for headaches while on this drug. C, I should report a persistent dry cough to my doctor. And then D, I need to avoid salt substitutes containing potassium. Which one would you guys say this is? All right. This one would be B. I can take ibuprofen for headaches while on this drug. This statement right here needs further teaching. Um, as you guys know, ibuprofen is an NSAID. Okay, so NSAIDs such as ibuprofen reduce the antihypertensive effect of ACE inhibitors. and it increases the risk of acute kidney injury, especially like both of them in combination. So this statement requires correction. The other statements are all accurate. ACE inhibitors commonly cause dry cough, so that's an effect that you will see on the bottle. And angioedema is very serious, so if you start having issues like that, of course you have to report it. Okay, so for potassium sparing effects mean client must avoid K plus supplements and salt substitutes, and antihypertensive must be taken even when asymptomatic. So in this case, the best option which needs to be addressed is I can take ibuprofen for headache while on this medication. Okay. So we just did 1 through 10 of these questions. I'm going to leave this video up if you guys want to watch it. That's fine. I'm going to just try to figure out a schedule where I can come on and do more lives so you guys can see, you know, get a gist of, okay, that's something here, that's something there, or, whatever the case is. So I will try to figure out a schedule with you guys so I can post more live videos of, going over practice questions and doing the rationales, and so on and so forth. Okay, so we will be doing that. If you guys have any questions or you guys want to see different stuff or you guys want to know other stuff, please reach out to me. You can drop a comment. A lot of people reach out to me when they see my email, or they'll drop a comment and I put on my video, and I'll try my best to respond. Okay, so that is it for today, guys. Thank you guys for tuning in, and I will see you guys in another NCLEX practice question session. Okay, so yeah. I'm so happy for those of you guys that tuned in. I know earlier we had sound issues, which I hope is better. Some people say they can hear now, but yeah. So I am so happy you guys tuned in. Make sure you guys tune in next time because I will be doing more practice questions online with you guys. And of course, I'm going to fix the next set of lives because some of the questions were cut off. So I'm going to fix it next time and I will go through the questions and so on and so forth. So thank you guys for tuning in. If you have any questions, like I said, reach out to me. I am more than happy to help you. Also, I do have a planner that I made. It is an advanced nursing planner. You guys are going to love it. I am going to. Let me see if I can insert the picture here and show you guys. Let me see if I can find it. Hold on, guys. I have my nursing fundamental handbook that I'm selling, guys. So make sure you guys check this out. Okay. And then I also have the nursing planner. I'm going to show you guys a picture of that. And then yes, the advanced nursing planner. You guys check that out too. So if you want, you guys can check my Etsy. You will find that there. But this planner is very advanced. It has everything that you need. So please make sure you stop by, take a look, and if you're interested, go ahead and get yours. But thank you guys so much for tuning in. I am so happy that I was able to do this live today and help you guys. If you guys have any questions, just let me know. You guys have a great day. See you guys. Bye. Alright guys, you guys have a good day.